We have 4 videos on health insurance. 1 on health insurance basics. 2nd is learn the health insurance lingo. 3rd is health insurance plans. And 4th is enrolling in health insurance and choosing a new PCP. Not all health insurance plans are the same. Each plan may vary for services they will pay. It is important to understand the insurance terms when making decisions about health insurance. Step number 1, where to start? Start at the beginning. Let's start by reviewing common words used in the health insurance world. First one is benefits, the services your insurance covers and how much you will pay. Then you have your eligibility, requirements you must meet to qualify for specific health insurance plans. Then you have your premium, monthly payments amount you owe each month for insurance, separate from your copay or deductible. If you don't pay your premium, you could lose your insurance. For example, you must pay your cell phone bill each month or your service will be turned off. Then we go to our types of cost sharing, such as copay, a fixed amount, for example $15, you pay for a covered healthcare service, usually when you receive the service. The amount can vary by the type of covered healthcare service. Then you have your deductible, the amount you pay for healthcare services before your insurance pays. A deductible is not required for all services, such as yearly checkups or even vaccines. For example, if your deductible was $1,000, your insurance will not pay anything until you pay those $1,000 out of pocket. Deductibles start over every year. Then we have our co-insurance, your share of costs of covered healthcare service calculated as a percent, for example 20% of the allowed amount for the service. You pay your co-insurance plus any deductibles you owe. For example, you had a doctor visit that costs $100. Co-insurance is 20%. You will then pay $20. Then we have our preventive care, which is services such as yearly checkups or even vaccines that will help keep you healthy. This is usually paid by the insurance under the Affordable Care Act, also known as the ACA. Then we have our out-of-pocket maximum. This is the most you pay during a coverage period, which is usually a year. Then we have our explanation of benefits, also known as the EOB. This is a summary of charges for services that is not equal to the bill. It is very important to review it. And finally, your PCP is a primary care physician, also known as a doctor, who manages basic illnesses or preventive care and, as allowed under state law, provides, coordinates, or helps a patient access a range of healthcare services. And here's a tip, always ask questions if you don't understand the insurance terms. For example, can you break down what you just said so I can understand it better? Be sure to check out our other videos on Introduction to Healthcare Insurance.